Hello and good evening. So today we have session for the foot drop examination. So let's start it. Most of the time scenario given to you is that there's a patient, for say Mr. James, a 45-year-old patient, and presented to you with numbness, and that too after radio frequency ablation of right lower limb, and this was done for varicose veins. Now the patient has presented with numbness of lower limb and especially of the foot, and now your task is to perform is that you will have to communicate with the patient and to do a relevant examination. So they will not ask you that examine either the neurological examination or foot examination or an examination. No, the task will be that perform a relevant examination. So it is you do have to decide which examination you are going to perform in the next 6 minutes. So that is why I always say that this 1 minute you are given to read this scenario and then to comprehend that and then to proceed accordingly. This is your key. If you don't understand this scenario, you may perform a wrong examination and the whole of your station may go wrong. So that will, and then obviously you will not be marked for that, and it has been seen and judged in the previous many stations and many exams by different candidates. So this 1 minute is the key. Next, you will enter the room, and for the next 6 minutes, what you have to do, first of all, you will do, and never forget and remember, this screen, this slide contains at least 5 marks. So wash your hands, introduce yourself. Hello, I am Dr. Muhammad Sulkarnain, one of the surgical exam candidate. May I confirm your name and age, please? And then you will say that today I have been asked to examine your lower limb, right? And then you will explain your examination, what you have to perform in the next 6 minutes, and you will say that for this I will have a closer look, then I will check for your movement and also your walk, and I will feel that, I will look that, and I will perform some special test, and I will also check for sensations and also for some reflexes. So after that, you have explained to the patient. Next, what you are going to ask, and where most of the candidates forget, that after that you have to ask the patient, are you okay with that, and do you understand everything what I have told you? So this is key and this is very important. So remember, the examination scales contains only 8 marks, and rest of the 12 marks are related to your communication skills. So that is why it is very important that your communication skills must be up to mark. Then you have to say that ask the patient adequate exposure, and for adequate exposure you have to explain to the patient that for this you have to take off your trouser, but don't worry, you can keep your shorts, and then for the Mrcs exam it is important to ask for chaperone. Remember, it is important to ask for chaperone in Mrcs exam. So you will say that don't worry, we have a chaperone with us, and also you can keep your shorts. After that, position of the patient, obviously that is important, and that varies from for each and every test. So let's begin. First, what you have to do is to check for the gait of that patient, and for the gait, first of all, check for if there are any crutches or other supports the patient contains, and if contains, then you have to mention that the patient contains the crutches. Okay. Second thing is then you have to demonstrate the patient that, and how will you demonstrate, because this is the command in the examination that matters the most. So what you will say that, okay, Mr. James, can you do you have any pain in your legs right now? It's okay. And then you will say that, can you please walk towards wall for me, and don't be afraid, I am with you, and you will not fall down. Okay, so this will be your command. So and then you will ask the patient to walk, and after that there will be three types of walks. Normal walk, you have to get assess that, and then normal, and then normal heel strike, and then on the tiptoes. So on the heel, on the tiptoes, and a normal walk. So three types of walk you will assess. So you will say that, can you please walk your walk, and then please turn around, and now can you please walk on your heels, and now can you please walk on your tiptoes. So, and then you have to assess for stepping height. You know that if the patient is having this common peroneal nerve injury that may be expected in a patient who has varicose veins surgery, and so there will be high steppage gait. So it is important that you have to observe for that. Then you have to assess that it is smooth and symmetrical, and you have to assess also the patient's shoes and tiptoes and heels. Obviously you have to go for that. Then you have to go for inspection. So inspection is very important in particularly this scenario, because this patient has undergone some kind of radio frequency ablation surgery. So if the patient has gone surgery, then he will be having some kind of scar mark. So although the patient will be not be the real patient, it will be an actor, and they will have a scar near the head of fibula. So you have to look for especially for scar. Then you have to see for any toe alignment, any bunions, especially in the metatarsophalangeal joints. Then you have to see for any swelling or erythema around the foot or the ankle. So particularly important in this scenario will be scar mark. Next, okay, then one important thing is that you don't need to have ask the patient to turn around. It is you who have to move first from the front to the side, and then from the side towards the back. So don't ask the patient to turn around for you. It is you who have to be on that side. So first of all, you will assess from the front, and here you don't just go and assess. Here again, command is the key for your examination. So you say that, okay, Mr. James, I'm going to have a closer look to your knees and your legs. Is it okay for you? So before performing every step, either you are going to inspect, feel any reflexes, any tone, you have to explain to the patient. So that is how you are marked. So from the front, you will ask the patient, I am going to have a closer look to you. And then you say, observe the evidence of flat feet. So obviously there will be pes perennis or pes cavis. You will look for that. And also the patient is having some, if the patient is having some super flat feet, then the patient if walks on tiptoes, then you will see that either it is has been corrected or not. It is corrected, that it means it is a flexible one, and if it is not corrected, it means the patient is having a rigid one. So one you know that one speed star bowler Shoaib Akhtar, he has a problem with his foot arches, but he became a speed star, you know. And then you have to go towards the back of the patient, and when you go to the back of the patient, again explain to the patient, ask the patient that, okay, Mr. James, now I am going to have a closer look from your back, is it okay for you? And then you will have a closer look there for the heel alignment, and then any valgus or varus deformity, and also you will look for, especially in this case, you will go look for Achilles tendon, any deformity, any erythema, discontinuity, any rupture, any swelling. So you will look for that. So after that, you will ask the patient. Now the patient, all this examination is done up to this point while the patient is standing. So next you will ask the patient to lie down, and then you will ask the patient lie down, and now I am going to feel, I will check what temperature, and if any you have any pain. So you will assess for temperature and tenderness on the legs, especially on the foot, and also along the whole of the leg. Here important thing is compare. So we'll compare the temperature, any tenderness, and you will compare that. So after that you will check for pulses, especially the posterior tibial and dorsalis pedis, and then you will palpate for the Achilles tendon. So this palpation of the Achilles tendon, it can be done either the patient is sitting or the patient is lying down. So better is that you do it when the patient is kneeling on the chair. So you can do it either before asking the patient to lie down on the bed, so that it's the only one time the patient goes on the couch, or you can perform at the end, not in between. So if you have, once the patient has been gone to the couch, and you will ask again to come on the chair and again to the couch, then it will just waste your time and also deduct your marks. So it is your own arrangement. Either you do it before asking the patient to lie down, then it is a good that you go for that, and even at the end of the examination that is done on the lying down position, you can ask the patient. So how is it done? Ask the patient to kneel down on the chair and palpate the gastrocnemius muscle, Achilles tendon, and you will assess for any focal tenderness, any swelling. So if there is any focal tenderness, then obviously the patient will have Achilles tendonitis, and you will also assess for any rupture, any gap in the tendon. You will assess it, you will feel it, and how will you do it? It's like that. This is the chair, you can see here, this one is the chair, patient is kneeling down, and you will assess gastrocnemius and then this Achilles tendon. Next is that you have to perform all the other palpations. You have to perform the palpation for the posterior tibial artery. Here you will perform for the dorsalis pedis artery between the first and the second metatarsal. Then you will assess for and you will palpate for these bones and squeeze across the metatarsophalangeal joints, and you will see if there is any sign of discomfort. And you will also then you will perform palpate the tarsal bones. Here you will palpate the tarsal bones. So, and after that you will perform some sensory examination. So in palpation, first of all, temperature, tenderness, then the foot examination, especially the pulses, and then Achilles tendon, and also tarsal, metatarsals, and all the bones. So you will perform it, and you will perform it bilaterally. You will perform it bilaterally. You will perform it bilaterally. And then sensory examination, that is very important, in particular this patient, although in some videos it is not given, but you have to perform it because it is the key that you will get in your patient, and there will be findings indeed. So you will perform number one is Tinel sign, then light touch, and then pin prick. So you will perform Tinel sign, light touch, and pin prick. So how would you perform Tinel sign? So you will tap along the course of the common cranial nerve or at the head of the fibula, and if the patient gets some tingling sensation, then it means it is positive, and it means it's a positive sign. Tinel sign is positive. Then you have to perform light touch examination and pin prick examination. So you will perform these two examinations, light touch and pin prick examination, where along the whole leg. So it is the leg. So you will perform here from the if for example if it is a right leg, you will perform it on the right leg starting from the knee joint L3, L2 and L3, and you will start downward on the lateral side, then the medial side, then come downward and the lateral side of the foot, and then dorsal and plantar, and then medial side, and then you will go upward, and similarly on the left side. And then similarly you will go for the same pin pricks sensations similarly. But before that, there is a very important thing to explain to the patient. What's that? Just think on that. What's that you have to explain to the patient? That is, you will take a cotton wool. You will take a cotton wool and you will explain to the patient, okay, Mr. Jim, now I have this cotton wool and I am going to touch it on your sternum. I am going to touch it on your sternum, and you will say that, can you please feel it? If the sternum is not exposed, then you can touch it on the his forehead, and you will ask the patient, can you please feel it? Yes, okay, I can feel it. Then you will ask the patient that, okay, Mr. James, now I am going to touch this same cotton wool on your legs, on your legs, and you have to close your eyes. Please close your eyes, and then don't forget to use the word please. And then please let me know when you feel every time. So you will take the cotton wool, you will touch it on the legs, and okay, are you feeling it? Are you feeling it? Are you feeling it? Okay, nice. Are you feeling it? Okay, great. Are you feeling it? And similarly then on the other leg. So that is how you have to perform this important sensory examination. And then after that, obviously you have to perform the pin prick examination. You will be given a small pin that will obviously blunt. So blunt pin you will be given, and you will ask the patient, okay, can you please open your eyes, because you have already performed light touch examination and patient eyes will be closed. So you will say that, can you please open your eyes? When the patient opens his eyes, then you will say, okay, now I have this small pin in my hand, and don't worry, it's not hurting and it's not painful, and I'm just touching it on your sternum or your forehead. Can you please feel it? Okay, now you can feel it. And now I'm going to perform same examination as previously with the cotton wool, and now every time you feel it, please let me know. And then obviously you will go for that and that on the whole of the leg and on the both legs. So this is how you have to perform this pin prick and light touch examination. After this sensory examination has been completed, up till now we have done with first of all gait, then inspection, then palpation, and then sensory examination. So our four components of this important examination for the foot drop patient have been completed up till now. So now we have to go for the motor examination, and for the motor examination for the motor component and to move the component, they obviously this is the examination particularly related to the foot, because the patient will present to you with foot drop, high stepped gait. And this is very important, and there are two types of movements. Number one is the active and number two is the passive, and you have to assess for both. So active and passive, and then along with that you will have to ask for the crepitus, and then you will assess feel for the crepitus. So first of all, you will ask the patient for the foot plantar flexion. So what will be your command? For example, you are assessing that this patient is having plantar flexion. You have to assess for that. What will be your command? So what will you do? You will put your hand on the plantar surface of the patient's foot and ask the patient, can you please push down on my hand? And meanwhile, your other hand, if I see here, okay. Meanwhile, when you are asking the patient that can you please push on my hands, because one of your hands will be just here in front of the patient's plantar surface of the foot. So we'll ask the patient to your other hand will be here, so that patient may not push your hand with the help of his leg, with the power of his leg. So it is very important that if your right hand is under the plantar surface of the patient, your left hand will be on the leg for two purposes. One, to assess for any crepitus in the joint, and second, to stabilize the leg, so that patient may not use his power of the leg and only use the power of foot. So similarly, first the plantar flexion, then your hand will come upward. Your hand will come upward and your other hand will remain same, and you ask the patient, now can you please push on my hand again? Just put your hand on the upper surface, ask the patient to push on my hand again, and similarly perform on the other side. But don't forget to put your other hand near the ankle joint. First, I have told you for two purposes, to feel for crepitus and to stabilize, so that patient cannot use his leg power to push your hand. So this is how active dorsiflexion as well as the plantar flexion is done. Then obviously you have to ask for active toe extension and toe dorsiflexion. So toe flexion and toe extension. So what you will do now, your one hand will be here on the tarsals, here on the metatarsals, and you will put your finger underneath. If you are asking for the plantar flexion of the big toe, then you will put your one finger underneath the right or left big toe and ask the patient, can you please push against my finger with your toe? Okay. And similarly for the dorsiflexion or extension, you will ask of the big toe, you will keep one hand, left hand on the tarsals, and your other hand that will be here on the dorsal side, and you ask the patient, can you please push with your big toe on my that particular thumb or finger, whatever you have put there. So patient will just put there his pressure along with his big toe. So that is how you have to perform this active toe flexion and toe extension of the patient. And then after that, you have to ask the patient for active inversion as well as the inversion and eversion, because this patient is having expected injury of the common peroneal nerve. So you know that common peroneal nerve is necessary for both movements. So you will ask the patient, can you please turn your foot inward, and then you can explain it with the with the help of your hand. Ask the patient, can you please turn your foot inward and now outward. So you can use your hand for this explanation, but don't forget to put your other hand here, and don't forget to compare. Don't forget to compare. So you have to do both things. Okay, so three types of motions. I use dorsiflexion of the ankle joint and plantar flexion, and extension and flexion of big toe, hallucis, and then inversion and eversion. And then after that, you have to perform all these movements by passive movements. So you will perform now ankle dorsiflexion, plantar flexion, eversion, inversion, and hallux, extension as well as flexion. So you have to perform all these 6 motions by your own hand. And again, you can see here in the picture, he has put one hand here for 2 purposes. One, to stabilize it, and second, for crepitus. Similarly, you can see it that you have to perform this movement on 2 separate joints. Number 1 is ankle dorsiflexion and interplantar flexion, and the second one you see here that it is subtalar inversion and eversion, and then mid-tarsal inversion and eversion. So you have to perform all these movements on the foot for foot drop examination. So toe flexion, toe extension, ankle foot inversion, eversion, these are the active movements. Passive movements of the ankle joint, subtalar joint, and mid-tarsal joint. At 3 joints you will perform these passive movements, and but you will not need to perform any active movement as these joints. As these joints, ankle joint and subtalar joint and mid-tarsal joint, you will perform only passive movements, no active movements. And then you will perform metatarsal phalangeal joint and metatarsal phalangeal joints and interphalangeal joints. You perform passive movements as these joints also, but it will be completed in a matter of just duration of 1.5 to 2 minutes, not more than that. So after that, motor component, and now you have to perform some type of coordination, heel to chin coordination, and how you have to perform it. The important thing is how you will explain it to the patient. So you will ask the patient that, okay, Mr. James, can you please put one of your right heel on your left knee joint. Your right, for example, if I'm checking for the right side, I will say right heel on your left knee joint and drag it downward towards the foot. So this is a simple command and easy command you will give to the patient, that you please put your right heel on your right left knee and drag it down, and then ask the patient, okay, again and again for 2 to 3 times. And similarly, you ask the patient and same on the other side. So this is how you will perform heel to chin examination. Then you have to perform some kind of reflexes, and there are two reflexes to be performed, and I have put different type of positions for the patients, either whichever is comfortable for you and for the patient. Both are recommended, and both are acceptable. So there are two types of reflexes, knee reflex and ankle reflexes. I would suggest that perform these reflexes at the end and should be performed in the sitting position. So the important thing in both these reflexes is that the muscle twitch you have to see for must be exposed, and you must be looking at those muscles contraction, not on the movement of the foot. Okay. For example, if you are performing this examination, this ankle reflex examination on the patient, and you have not exposed this gastrocnemius muscle, then your examination is failed. Or you looking at here, your examination is failed. Or you have not stabilized it with your other hand, then your examination is failed. So these are the key points while you are performing the examination. And fourth most important thing is that patient, this whole leg must be relaxed. And so you have to explain to the patient, please be relaxed, and I will tap with this light hammer. It will not harming, it will not hurt you, and I will slowly perform it. And second, and the sixth thing in performing any reflex is that your hammer fall must be free fall. It should not be just tapping like that. It should be a free fall. So it will be a free fall on the this Achilles tendon, and you will look here, and you will stabilize it, and then your leg must be relaxed. So it can be performed in this position either, or you can perform it that the patient in this position, either he has shown it knee reflex, but you can perform it in this sitting position while the patient is sitting. So you have to hold his foot, just tap on the back, and look for the gastrocnemius muscle contraction. Similarly, for the knee examination, there are two positions which are recommended. Either the patient is sitting, then you have to perform, or the patient is lying down. So if the patient is sitting, the most important thing is you will not sit in front of the leg. You will not sit in front of the leg. Otherwise, if the patient is having hyperreflexia, he may harm you. So if you sit in front of the patient, then you will be your marks will be deducted. Okay. Second, again, in this examination, it is very important in knee reflex, because you have to look for the muscles here in the quadricep muscles. So you will tap here, look here, and the movements of the movement, you will not look for the movements, but contraction in the quadricep muscle. So, and you will tap here, and your tap should be gentle and should be free fall. And second position is this one, that is lying down position. In this position, you should hold the patient's lower leg. It should be off the bed, and then you have to tap here and look here and look here. So this is how you will perform this important knee examination, knee and ankle reflexes. Then there are tone. Then you have to perform the tone. So there are three tests for tone. Number one is leg roll. Number one is leg lift. Number two and number three is clonus. So there are three tests which are performed to judge for the tone of the patient, lower leg, and this is how you perform it. The patient is lying down, and then you can see one hand on the thigh and the other hand on the leg. So simply you will, this is leg roll. So simply you will give a small movement here in front, to and fro motion, and you will check if the patient's heel gets off the bed or not. Just simple. So it's a very simple test, and then you will perform on the right side as well as on the left side. So it's very simple. You will just roll the leg on the couch and will see not towards the face of the patient, not towards the face of the patient, but towards the heel of the patient, if it is getting out the bed or not. Then you have to perform leg lift test. And how is leg lift test is performed? First, you will explain to the patient before each and every test. You will ask the patient that, okay, I'm going to briskly lift your leg from the knee joint, and don't worry, it will not be hurting you, and please put your leg as relaxed as you can. And then simply with the two hands you will briskly lift the leg outside the bed, and we'll see if the patient's heel gets out of the bed or not. If it gets out of the bed, it means it's abnormal. And next, last one in the tone, to check the tone, is the ankle clonus. And how will you perform this ankle clonus? Important thing you will see here, that patient has the examiner has put his hand here at the gastrocnemius muscle. So we'll put your hand at the gastrocnemius muscle, hold it there, and then you will, with your other hand, you will do a to and fro motion, and then you will after that you will just make it stable here, and you will look for rhythmic movements by the foot at the ankle joint by itself. And if it is more than 5, it means it is abnormal. So that is how you will perform these important tones tests for the foot. Now the last test to be performed here is the Simon test, and it is for the rupture of Achilles tendons. So because you have to perform Achilles tendon Simon test, so if you are left with time to perform the Simon test, and you know it is done in this bent position of the patient, so no, if you are left with the time, then these two reflexes, these are reflexes of the patient, as well as this Simon test, you have to perform in the sitting position. So I would say that ankle reflex and then knee reflex and Simon test, these should be performed at the end, and these should be performed in the sitting position. So you will perform this Simon test, and you will ask the patient to kneel on the chair with their feet hanging off the edge. Number 1. Number 2, squeeze each calf, and then normally the foot obviously should go for plantar flexion, and if there is a rupture, there will be no movement. So this is how you will perform this Achilles tendon test, or Simon, also known as Simon test. So you will squeeze the gastrocnemius muscle and look for the plantar flexion of the this foot, and then at the end you will thank the patient, you will wash your hands, and don't forget to cover the patient. I will say okay, you can cover, and do you need me, you need my help to cover you, okay? But in the exam, most of the time patient does not need to be covered. They will not ask you to cover. And second, patient will already be exposed most of the time, but it may be covered. So you have to go for that, and then you have to explain to the examination to the examiner that I have to perform knee and hip joint neurovascular examination of the lower limb, and then they will ask you for the imaging. You will say for the X-ray, CT, and MRI. So that is how you would perform this important examination, starting from the very important walking of the patient, and then towards the end you will perform this Simon test. So this is how foot drop examination is performed. So it's end, and see you for the next lecture.